Thank you very much for joining us. And I can't think of a more challenging time to be running a hospital organization as large as yours than what you're facing today. So both grateful for the time and of course for your election as chair of MMAC. But picking up on our conversation with Dr. Raymond, just let me check in with you. You run an extremely large healthcare system. You're in close touch with your colleagues. What's the current state at Froedtert, and what are you hearing from your colleagues?
So we're no different than anybody else. So let me just reflect on the state. And I am still serving on the WHA board. We are full across the board. Every single hospital in the state of Wisconsin is operating at, or quite frankly, above capacity right now. Several of our hospitals are above capacity, which means we're in surge plan right now. So what does that actually mean? We have been running what I would say, quote unquote, in the red for 90 days. And the problem is within the last week, we are surging on COVID again. So we are clearly seeing the post-Thanksgiving surge come at us. And we were running pretty hot on COVID before that. We are at the highest numbers, and this is statewide data, of any number in 2021 on COVID. And we are approaching, quite frankly, the numbers that we saw last fall, in the fall of 2020, when this region experienced one of the highest per capita surges in the entire United States. We're on the cusp of that right now. So, and the worst part about this is we have less people that are working for us right now to actually be able to deal with that. People have left healthcare in significant numbers. Retirements are almost double. Right now, people are leaving healthcare to go work in other professions. And of course, just like all of you, we employ entry-level workers who can go anywhere, to work. And we all know what's going on with that level of workforce right now, in terms of their mobility, driving wages up, and all of those type of things. And just so everybody is clear, there's no federal money coming into healthcare systems. There hasn't been for over a year. So all of this is being paid for, by the healthcare systems that we have today. These are real implications for our community. Transfers are extremely limited right now to try and get into a facility that can care for you non-COVID. So we are limited in capacity. We are monitoring surgeries. They are getting deferred. They're getting done, but they're getting pushed out. But if these numbers go much higher, we are going to have to take more dramatic steps. And quite frankly, we're preparing for that because we think that they are. And this is all Delta. As Dr. Raymond said, this is all Delta. This has nothing to do with Omicron. And so all we can do is just continue to manage capacity. And if we get much higher, you're going to start seeing hospitals have to constrain services much, much more than we are today. So it's quite severe. And it's a problem. And I would just emphasize what John said. There's a reason people are leaving healthcare. This is 2 years of a very long slog, and they can't do it anymore. So all I can say is please do everything you can to stop the surge, and it's vaccination. That's simply our way out.
Yeah. Cathy, one of the questions that came up earlier that I didn't get to is probably one of the most challenging you have to deal with running a hospital. When you reach capacity like this, especially in ICU units, what's the decision-making process just from an ethical standpoint about who gets treated and who doesn't get treated when you run into a situation like this where you're so full?
Luckily, we haven't reached that level at the highest levels. Our ICU capacity is adequate. And again, I think we're very lucky in Wisconsin that we have systems. So we can move our patients around. And quite frankly, the collaboration, within system, but also the collaboration is phenomenal, in terms of trying to help each other out. Our ability to help each other out is becoming limited. So we did pull all of that out. We looked at that during the initial days of COVID. We have those plans that are out there, but we are not operating at that level, right now in the state. Right now, what we can do is we defer other cases. We still do have some capacity, and I hate the word elective. I'm not going to use it, deferrable, because somebody who's in pain, is not elective, but they're not emergent, so we do still have capacity on deferrable services. That's what we would do next, to be able to start creating capacity for the most urgent cases. And so that may not be optimal for the patient, but we are not operating at a, having to make life or death decisions. That's not at all the level. There is capacity in deferrable services, and that would be where we go next.
Yeah, let me transition a little bit and ask you about your role as MMAC chair. You were elected last week by your peers. Obviously, that wasn't a surprise to you. You had the nominating committee reached out to you a year ago. I kind of thought we'd be through a little more of this today than we are. But let me ask you the question: why you accepted the role, and why you feel it's important?
Sure. Well, it's way more exciting, than talking about COVID, and way more positive, but I think I've had the opportunity to serve on the MMAC board for a number of years now, and I've had the opportunity to see just how effective the organization can be bringing the employers in the area together to create benefit for our not just our employers, but our whole community. So once you've had experience with an organization, you can see what they can do. When you're asked to become part of that leadership, it's just a massive opportunity. And so that's how I really saw it. I also believe in the power of collaboration. I see that with my own health system colleagues. I've seen what we've done on the MMAC, and I think we have even more power collaboratively to improve our region and continue to grow jobs and work together for all of us, improve our livability. This is a great place to live, be, work. It has great promise for us, and you can build on all of those strengths, but we also know that we have some gaps to close to make sure that that promise can be delivered to more of our citizens and then really have all boats rise. And so I'm excited about that work that Jonas really launched underneath his leadership as the board chair, and Tim, you've really structured together. So really excited about that work too.
Yeah, thank you. So as you think about the next 2 years, obviously COVID is going to be part of this discussion, and you bring great experience with that. But what do you intend to focus the organization on over the next 2 years?
Yeah, I mean, obviously continuing the region of choice work. We've been doing this work for over a decade at Froedtert Health. And what's really been so effective for us is really using outside pledges, outside commitments, outside goals to drive ourselves to do better. And I think that's what's so great about region of choice is that we have very public goals, and we just reported on them, at the annual meeting. And I hope that that really drives effective and long-lasting change. So really excited about region of choice. And who can say even more now with the workforce pressures that we're seeing, bringing more people into the workforce, making sure that it's not just about jobs, but about education and investing in our communities with supplier diversity, all of that, just really works. I'm excited about continuing what has been a really successful run on bringing and attracting business to our region. I think we've had a fantastic run on that. We have massive opportunities, so really excited about continuing to do that. Really excited about ramping up our entrepreneurship muscle, bringing new capabilities to the board, adding board members who are entrepreneurs, mentorship programs, so excited to add that capability. That's something that I've heard is a discussion point in Milwaukee for close to a decade. So really excited to start to see that as well. And then, as we all know, we would like to see some changes in funding and how we share revenue with the state so that we can see more investments in the city and the county in terms of cultural assets, livability, and those different types of things. And so clearly that's another initiative we'll be working on.
Yeah. Let me also ask the question about the importance of business leaders being engaged to collaborate and help the region grow. And, as someone who runs an anchor institution, you get this intuitively, but how important is it for your peers and you to engage in some of these issues?
Yeah, so as an anchor organization, and they call them meds and eds, higher ed and healthcare aren't moving. We can't pick up, and go someplace else. We hear, so when you're an anchor organization, but I think this applies to any of us that do business here, is that you're investing in your community to be able to make sure that you have customers for your business, people who can afford, to actually take advantage of your services, and to be able to create a workforce, to be able to do our jobs. And then I think even more so now today, attract talent from other areas. So we have had this great run on expansion and attracting businesses and jobs to our area. We need talent. And so it goes beyond just growing our own. We clearly have to grow and invest our own, but we have to create a region that actually attracts people who want to come and live and work here. So I think that that's why all of us together understand that it's not just doing our own, it's investing in education. It's actually being very conscious about buying local and investing in our suppliers of all, diverse suppliers, all of those different types of things, because only by investing in our community are we going to have the resources for our own businesses to thrive. So I think it just makes intuitive sense. And it's really helped drive, quite frankly, a lot of our priorities at Froedtert.
Yeah, one of the things, and we've talked about this a little bit, that I'm really excited about is having you in the role as chair and bringing your experience running a large, diverse organization. And so as we talk about looking ahead at the region, we want to look at, in a transparent way, our strengths and weaknesses. So I'm interested in your experience and how you think that'll translate to helping the region really look at its strengths and weaknesses and plot a course forward.
Yeah, we are a planning organization at Froedtert. We spend a lot of time on this. So we're pretty deliberate, about periodically, you can't do it every year, but to step back and take a look at how you really are going to continue to move your organization forward. And I think to drive that success, you have to be data driven in terms of what's really going on. We all bring anecdotes, we all bring our experiences to the table. What we have found is that using data to actually understand what's going on is incredibly important. Understanding your environment, and look what kind of environment we're in today. All of us are struggling in terms of what truly has fundamentally changed and shifted because of this pandemic. And we know that we have. What is maybe more temporary? It could happen for a year, 2, 3, maybe, that might shift back. And what do we think is going to rapidly snap back? And quite frankly, I think that's the hardest part. Who can predict anything, as well as the course of this, but understanding environmentally that there really are fundamental things that are not going to go back, and how do we prepare for that? I think that's going to be another big one. And then how do you really critically examine yourself? How do you then, once you've kind of identified your data in your environment, where do we think we need to be and what are the gaps, to being able to get there? We have great strengths in this community. How do we capitalize on them? How do we take advantage of that? But at the same time, how do we organize ourselves around closing our gaps and understanding those threats that could be out there also as well? So you work both sides of the equation, and we have great strengths to leverage also as well.
Oh, that's fantastic. I'm sorry, I was busy taking notes. I think my to-do list for the next 2 years. So just kind of a closing thought here on your end, from your experience here, how do you assess the region's pluses and minuses?
Yeah, and I've told Tim this, I'm still a newbie. I've been here a little over 11 years, but I'm still considered a newbie. But I think that gives a fresh perspective of, I think being from the outside, I can recognize more of Milwaukee's pluses. I think this is a fantastic place to live. The livability factor up here, when you compare that to our upper Midwest types of metros that we compete against. Yes, I hate the weather. I'm born and raised in it, but I hate it. But Chicago has the same weather. Minneapolis has the same weather. Cleveland has the same weather, type of thing. And we have so many other pluses here, in terms of affordability, size. We simply do not have the traffic and congestion a lot of those other large metros do. The ability to get to our natural resources very quickly, our cultural institutions, we have so much promise for livability here that I think that we have so much to build on. We have a great track record on attracting business. We are growing. We have great jobs. We have great availability. We've seen some fantastic investment in our city, in our center city, that really has, grown down there. So again, we have great promises. Our biggest gap is making sure that all of our citizens enjoy and that they can feel that they have the same economic opportunity, educational opportunity to take advantage of all of that. And we know that that's one of our gaps. We've measured it. We use data. We talked about that at our all-member meeting about where we rank in terms of our metro peers. So we know that that's a gap. That's an objective gap. And again, I think it's not only retaining people and activating the people who have grown up here, lived here and everything, It's talent attraction. You know, people younger than me, my kids, my generation, they want to live in a diverse, inclusive environment. And we've got to work on that here in Milwaukee. You know, if we're going to continue to be able to keep our people here and attract the talent that we need, all the work that Tim does on attracting business here is for naught if we don't have the jobs, you know, if we don't have the people, you know, to fill the jobs. So I think we have amazing promise here. I am truly transferred north of the border. I'm never moving back to Illinois. We plan to retire in Wisconsin. It's a fantastic place, and it's up to all of us. I think the employers can be a huge, huge driver in terms of closing those gaps in the region, and we're set up to do that, which is great.
Great answer. And I'm going to just go to one closing question here, and I don't want to leave us on a down note, but and clearly we've talked about this. The questions around the rise in crime and what we can do as a business community.
Yeah.
And, you know, I kind of go to, is it a cause or a symptom? But either way you answer the question, it's a challenging issue for the community.
Yeah, it is. And, you know, but again, I think what I always like to focus on our organization, is this a Milwaukee problem or is this a national problem? So I think that we have to put it into context. We know it's a national problem. I mean, crime is rising in all the cities, you know, right now. But then, so how do we learn from what others are doing? Because when it's happening in other places, then you can transfer, you know, knowledge. So how do we go out and learn? I do believe it's both a cause and a symptom. You know, it's both. You know, I mean, so if we can solve some of the issues we were talking about in terms of economic and educational opportunity, that will clearly reduce the drivers, you know, behind crime and violence. We know it does, it works, you know, so we have to work on the causes. And at the same time, yes, you know, we have to take more actions to pull down the symptoms, you know, I mean, to actually protect our communities, you know, in different ways. But I think that it's good to focus on context. You know, no one likes it, you know, in terms of the rise in violence, but it is happening everywhere. And if you know that, then how do we transfer lessons from other folks who have been able to, that's an opportunity for us. How do we transfer lessons from other people who are being able to make a dent in it? And that's how we always remind ourselves. I think sometimes we can get so focused on what's happening right here in our community that we don't focus that other people are going through the exact same thing. And how do we learn from that and be able to bring that back home?
Yeah, and I think the only thing I'd add to that, I think you're absolutely right, is the front end, back end. Front end, we want to make sure that everybody can take advantage of educational opportunity. And on the back end, as you mentioned early on, we want to make sure we have the funding to support the public safety that's important to each of us.
Right.
So I know we're a little bit over, Cathy. You've been very generous with your time. Thank you so much on behalf of our 2,000 members, all the community partners. We're really excited to have you in this role, and we'll have an opportunity to get you back on the webinar in 2022. So all our best, and thank you for joining us.
Thanks, everyone.